Hi, I'm Rebecca Colvin, Registered Dietitian Nutritionist at the Ridley-Tree Cancer Center. We are a grant-funded program, and as part of our comprehensive cancer care, we offer free nutrition counseling to patients undergoing treatment and within a year of treatment. So today I'm going to be talking to you all about vitamin D. So what is vitamin D? How is it made? What does vitamin D do in the body? Why is vitamin D important for bone health? How do you measure vitamin D status? What is a vitamin D deficiency and insufficiency? How much do you need? And what are some ways to meet your vitamin D needs? And finally, we'll be talking about vitamin D and cancer. So what is vitamin D? So vitamin D is both a nutrient we eat and a hormone that our bodies make. So it's a hormone that controls the calcium levels in the blood. It's also a fat-soluble vitamin, so it's stored in your body's fat tissues, and it plays an important role in building and maintaining muscle and bone health. So how is vitamin D made? So it's produced in the skin from the precursor 7-dehydrocholesterol. The ultraviolet B, or the UVB energy from the sun, converts the precursor to vitamin D3. Then in the liver, vitamin D2 and D3 obtain oxygen and hydrogen molecules to become 25-hydroxy-vitamin D, or 25-OHD. This form of vitamin D can't really function until it goes to the kidneys. So in the kidneys, it acquires a final pair of oxygen and hydrogen molecules to become 1,25-dihydroxy-vitamin D, which is the biologically active form of vitamin D, also known as 1,25-OHD. So what does vitamin D do in the body? So vitamin D assists in gene expression and cell growth regulation, and this function is relevant for cancer patients. It optimizes immune function, so it's a potent immune system modulator. It helps you fight off bacteria, viruses, including even having a role in fighting off COVID-19. It assists in decreasing inflammation, and it improves muscle and nerve function, so it helps your nerves send messages from the brain to the body, and it contributes to bone health. So vitamin D and bone health. Without enough vitamin D, the intestines cannot efficiently absorb calcium or regulate phosphorus. So when you're in this state of not having enough vitamin D, your body really only absorbs 10 to 15% of calcium. If you have adequate vitamin D levels, that number goes up to 30 to 40%. So if this happens, if you don't have enough vitamin D, your parathyroid hormone increases. This causes calcium to release from the bones and supply calcium to the bloodstream. So this happens so that these critical neuromuscular and cardiac functions can continue to happen. So in this scenario, your bones are bearing the brunt. So bone calcium density falls, your bones become weak, increasing your risk for osteoporosis and fractures. And just a side note, your serum calcium levels in the blood, so if you get your labs done and you have a calcium level, that doesn't indicate your bone calcium stores. So how do you measure vitamin D status? So one way to know is to just get a lab test done. So the gold standard of getting a vitamin D level checked is 25-hydroxy-vitamin D. So this is the form found in the blood. It's an excellent marker of your vitamin D status. It's measured in either nanograms per milliliter or nanomoles per liter. So 1 nanogram per milliliter is equal to 1 nanomole per liter. The other form of vitamin D, the 1,25-dihydroxy-vitamin D, is the biologically active form of vitamin D, and this is actually not a good measure if you're getting labs done. It's not as bioavailable, and it has a short half-life. So the chart on the right lists what levels are considered sufficient, insufficient, deficient, or severe deficiency for vitamin D. You can see that greater than or equal to 30 nanograms per milliliter is considered sufficient. And just to note that these numbers can vary from different organizations. These are the ones that we use in our clinic, and they're from the American Association of Clinical Endocrinologists. So vitamin D deficiency and insufficiency. So this can put you at risk for several things. Rickets, which is a softening of the bones in children and can lead to skeletal deformities. Osteomalacia, which is a softening in the bone of adults. Things like myopathy, excess inflammation, abnormal cell differentiation. So factors that impact vitamin D status. Latitude, so where you live matters. So in Boston, for example, there is little, if any, vitamin D produced in the skin from November through February. Aren't we lucky that we live in Santa Barbara, where we can get vitamin D year-round? Air pollution. So carbon particles in the air that are developed from the burning of fossil fuels and wood, they can absorb UVB rays, making it more difficult for you to absorb vitamin D. Skin pigmentation. So darker skinned people tend to have lower levels of vitamin D because they have more of the substance called melanin. So this substance competes for vitamin D metabolism. Sunscreen use in theory. So sunscreen use prevents sunburn by blocking UVB light. So theoretically, it can compete with vitamin D levels. Age. So older people tend to have lower levels of vitamin D. The health of your gut. So vitamin D is absorbed in the stomach. So if you have any kind of condition that can impact your stomach, then the vitamin D absorption can be lower. So for example, conditions like chronic pancreatitis or Crohn's disease. The health of your liver and your kidneys. So people with certain types of liver disease can't metabolize vitamin D. With kidney disease, it tends to be the more advanced kidney disease is, then the lower your vitamin D level is. Skin temperature. So warm skin tends to be a more efficient producer of vitamin D than cool skin. So on a hot summer day, you're more likely to absorb vitamin D than in a cold winter day. Fat mass. So vitamin D can be sequestered or trapped in body fat stores. So if you're someone that has high body fat mass, it's possible you might have a lower blood level of vitamin D. So how much vitamin D do you need? The RDA is the recommended daily amount, and it's based on no sun exposure. Your actual vitamin D needs may vary based on individual factors. So the RDA is from the Institute of Medicine. It's listed below in this chart. It's listed in micrograms and international units. So you can see that adults 19 to 70 years old and women that are pregnant and breastfeeding need 600 IUs per day, and adults 71 years and older need 800 IUs per day. And just to note that these numbers have recently been increased. So in 2011, the IOM felt that vitamin D is very important and felt that we needed more than they had originally thought. So vitamin D toxicity. It's really hard to get a vitamin D toxicity, and generally if that happens, it's from taking massive doses of supplements. The amount of vitamin D in food is really unlikely to produce a toxic level. Same with the sun, you really can't get a vitamin D toxicity from the sun. You just want to make sure that you're not taking more than 4,000 IUs per day of vitamin D unless you're being monitored by a doctor or a dietitian. Some symptoms of toxicity include nausea, vomiting, muscle weakness, pain, loss of appetite. Extreme cases could be kidney failure. So 3 ways to meet your vitamin D needs: sunlight, food, and supplements. And we're going to go through each of these. So for those of you who choose to get vitamin D from the sun, the Skin Cancer Organization recommends unprotected sun exposure for no longer than 10 to 15 minutes to the arms, abdomen, and back 2 to 3 times a week, followed by good sun protection. After that, your body will get rid of any excess vitamin D, and you'll be introducing sun damage without any added benefit. So vitamin D in food. There's not a whole lot of foods that have vitamin D, but they are listed in this chart. Things like cod liver oil, eggs, cheese. There are some foods that are fortified with vitamin D: certain juices, milk products, or plant milks. But because of the really low amount of food sources that are rich in vitamin D, for most individuals, especially if you're deficient, supplements really are necessary. And this, I think, is especially true for our patients that are vegan, because you can see that there's really not a lot of plant sources of vitamin D. So with supplements, there's two forms of vitamin D supplements, vitamin D2 or ergocalciferol. This is synthetically made from plant sources such as mushrooms, and it's found in fortified foods and supplements. This form is generally preferred by vegans for that reason. Vitamin D3 or cholecalciferol. This is naturally produced in the human body, and it's found in many animal sources, including fish, eggs. Some can be made from the lanolin found in sheep's wool. If you had a wool allergy, you would want to avoid this source of vitamin D3. It can also be made from lichen, which is something that's kind of a cross between a fungus and an algae, but this would be considered a vegan-friendly source of vitamin D3. Both vitamin D2 and vitamin D3 can raise your blood levels of 25-hydroxyvitamin D. Some research says that vitamin D3 might raise your blood levels for higher and longer than vitamin D2. So a little bit more on vitamin D supplements. So on the right-hand side of the page is a picture of a vitamin D label. And you can see that the vitamin D is listed in micrograms and in international units. So 1 microgram of vitamin D is equal to 40 IUs. Doses for supplements range from 400 to 50,000 international units. So they can come in different forms: liquid, soft gel, chewable tablets, spray, or capsule form. All of these can be good options. I would say if you have some sort of malabsorptive condition, then a spray can be a good option because it starts to get absorbed in the mouth. So with your vitamin D supplements, you want to take the supplements with your biggest meal of the day, the one that contains the most fat and oils. So things like olive oil, avocado, nuts. This can help the absorption by as much as 50%. It's not really necessary to take vitamin D every day. You can take it every few days, weekly, or even monthly. You just want to make sure you're getting the same total amount over time. So for example, if you were taking 1,000 IUs per day, you could change that to 7,000 IUs once per week. To correct vitamin D deficiencies, some protocols suggest taking 50,000 IUs per week, or taking 10,000 IUs per day for 8 to 12 weeks, and then a lower dose to maintain a healthy range. You would really want to work closely with a doctor or dietitian before implementing a protocol and to help determine how much you need. So vitamin D and cancer. Checking a 25-hydroxy vitamin D level is important for cancer patients. Cancer therapies can compromise vitamin D levels and bone health. There have been some studies done with cancer patients receiving chemotherapy and seeing a drop in their vitamin D levels. With these studies, we don't necessarily know if it was the chemotherapy or if it was the patient's food choices or the cancer itself or even lifestyle factors that lowered the vitamin D level. Some cancer therapies can make patients more sensitive to the sun, and so we would recommend them wearing, longer sleeves and avoiding direct sun exposure, and this could potentially lower their vitamin D levels. Certain hormone deprivation therapy can compromise bone health. So there's a class of drugs called aromatase inhibitors, labeled AI. Some of those include anastrozole, exemestane, or letrozole, and they treat breast cancer in postmenopausal women by reducing the amount of estrogen in the body. This, being that estrogen plays a role in bone health, if you're taking this drug, it can impact your bone density and cause fractures. So adequate vitamin D level in this population is important to support strong bones. Studies also show that there's an association between vitamin D supplementation and decreased joint pain, fatigue, and bone loss in patients taking an AI. So if you're taking an AI, it's important to request a DEXA scan when you start the drug and then 2 years after to help monitor your bone density. Vitamin D and breast cancer prevention. Vitamin D does not seem to be a major factor in preventing breast cancer. There were 2 really large clinical trials done. One, the Women's Health Initiative trial, followed roughly 36,000 women for an average of 7 years and failed to find any reduction in breast cancer risk in the women who received daily supplements of 400 IUs of vitamin D and 1,000 milligrams of calcium compared to those who took the placebo. The other study that was done, the VITAL study, looked at over 25,000 men and women who took 2,000 IUs of vitamin D or a placebo daily for 5 years, and rates of breast cancer between the vitamin D and placebo groups did not differ. So I think what's important to note in these 2 studies is the really large sample size. So, I think if you're someone who had a low vitamin D level when you were diagnosed with breast cancer, you can feel confident that that didn't impact your cancer risk. Vitamin D and breast cancer survivors. So evidence suggests that vitamin D may have a stronger effect on cancer progression rather than how it does on prevention, like we just talked about. There was a meta-analysis of randomized trials, which included the VITAL study that we just mentioned, showed that women who took a vitamin D supplement had a 13% lower death rate compared to the placebo. One study, the Pathways study, found that premenopausal women with higher vitamin D levels were associated with a lower death rate from breast cancer. The study had almost 4,000 women with breast cancer and were followed for 8 years. So in summary, vitamin D is a fat-soluble vitamin and a hormone that's obtained from direct sunlight, diet, and supplements. Many factors can impact your vitamin D status, from where you live to the air you breathe. It's important to know the amount of vitamin D in your bloodstream. Request to have your 25-hydroxy vitamin D level checked. There are very few dietary sources of vitamin D that are adequate. So, especially if you're deficient in vitamin D, supplements really are necessary. Cancer patients may be at a higher than average risk for vitamin D deficiency and insufficiency. Cancer patients with adequate vitamin D levels tend to have better outcomes. Breast cancer patients receiving aromatase inhibitors are at a higher risk of bone loss. So if you're a breast cancer patient taking an AI, have your DEXA scan monitored and have your 25-hydroxy vitamin D levels checked and supplement if you need to. Cancer patients may be at a higher than average risk for vitamin D deficiency and insufficiency. Cancer patients with adequate vitamin D levels tend to have better outcomes. Breast cancer patients receiving aromatase inhibitors are at a higher risk of bone loss. So if you're taking an AI, have your DEXA scan monitored, have your 25-hydroxy vitamin D levels checked, and supplement if needed. Vitamin D supplementation has been shown to reduce common side effects from AI. Vitamin D is a super important nutrient for bone health, immunity, mental health. It has a major impact on your body. Once again, I'm Rebecca Colvin, registered dietitian nutritionist, and have a great Pink Week.